It's week 3 into the mandatory stay-at-home order issued by the government to stop and contain the spread of the coronavirus pandemic sweeping through Nigeria, as infection rates keeps rising with fears the worst is yet to come.
We have 50 ventilators more after this visit, and beyond the ventilators, we have this extracorporeal membrane oxygenator, which is similar to a heart-lung machine, a very sophisticated equipment of which I'm not sure we have one here, but it's similar to a heart-lung machine to treat those cases where even the ventilator has failed. So these are the extremely important addition to our regiment of treatment options.
Nigeria's federal and state governments have tried to ensure the rights to food, shelter and other basic necessities for people losing jobs or income during the Covid-19 pandemic lockdown.
With what we're getting from the federal government, with what all of the private sector have also donated to the state government, this will go into our strategic COVID-19 emergency food response, which you all know the state government had started over a week ago, which has entered our second phase.
The economic assistance and stimulus packages that the government has announced in response to COVID-19 has exposed the inadequacies in Nigeria's social protection system and the risks excluding the country's poorest and the most vulnerable people, despite the palliative materials being distributed to cushion the economic effects. President Muhammadu Buhari announced on April 13, 2020 that the lockdown in place since March 30th in Lagos, Ogun and Abuja would continue for another 14 days.
Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT.
Nigeria has the biggest economy in Africa, with its gross domestic per capita more than twice that of its neighbors, Benin, Chad and Niger put together. The lockdown, however, prevents many Nigerians working in the informal sectors from traveling to work or conducting their daily businesses.
People don't move around, money don't exchange hands, and a lot of people, that's how a lot of people leave, and not having that movement means losses to all industries.
As the extension of the lockdown is expected to provide more hardship to millions of Nigerians living from hand to mouth, often less than $1 a day.
I believe the government should provide a solid and effective palliative program. As we can see, we've seen a lot of idle hands making noise on the street. If the government puts plans in place, we'll have less of that going on. The government needs to be very transparent. With this lockdown, it also means that when businesses need to reach out to get money locally and internationally to do their business, it's not going to trickle back the way it used to be. It's going to take a while for the businesses to come back. Even people that had money or assets yesterday, their assets are devalued. So that means there's erosion of wealth that's going to come out of this.
The emergence of COVID-19 and its increasing incidence in Nigeria has called for drastic reviews and changes in the earlier revenue expectations and fiscal projections.
I don't think there is any government that's been able to find a proper solution to this. On the one side, you're looking at taking care of your population in terms of healthcare, but the other side, you're also losing out in terms of productivity. We're seeing unemployment figures, skyrocket globally. And when you consider the informal sector that actually provides a lot of the employment, then you can just imagine the scale of unemployment, which would, on the other side, also lead to social vices.
The government has pledged a series of supportive measures to ease the financial pain on the most vulnerable and the Nigerian economy. But there has been widespread complaints to a much greater social economic effects on the population.
We have to look at social welfare expenditure. Developed countries have tried. I mean, it's still going to be a struggle. Given our population, it would be a hard thing for the government to try and do. It's certainly not going to be easy, but this is the time where government literally has to sit up and look at how to alleviate some of these things. So government has to put some palliative measures in place, at least to be able to alleviate suffering in terms of food, because the food shortage, especially in major cities. From the healthcare point of view, there's already a deficit in the healthcare industry anyway. So if this pandemic does take hold, we are going to need massive levels of expenditure in terms of upgrading our health facilities.
What the consequences of COVID-19 pandemic should further offer the Nigerian economic managers and policymakers is that the one-track monolistic reliance on oil is failing. Diversification priorities to alternative sectors such as agriculture, solid mineral, manufacturing and the service sectors should be further intensified. Please practice social distancing, wash your hands, stay safe, stay home, save lives.